Hello, I know we've been getting some questions lately about the use of caffeine as a supplement to improve performance, and coming to you today with a little information. You can read some of it off the slides, and we'll just have a little talk. Let's begin with taking a look at caffeine supplementation and how it affects team sports, the pros. Several studies have reported improvements in high-intensity intermittent exercise performance, which is the type of exercise performance we use in basketball, with a pre-exercise ingestion of caffeine at 3 to 6 milligrams per kilogram of body weight. Along with the performance aspect came an improved cognitive performance. A meta-analysis investigated the efficacy of caffeine ingestion, 34 placebo-controlled studies using 3 to 6 milligrams per kilogram of body weight to increase performance in team sports. The analysis concluded that the ingestion of caffeine increased single and repeated jump height, single and repeated sprint velocity, and reduced the time to complete agility test, as well as increased the total running and sprinting time. When we look at it that way, we would assume, yeah, let's everybody begin, 3 to 6 milligrams per kilogram of body weight. But unfortunately, like with all supplementation, there can be downsides and side effects. So the cons for caffeine supplementation is gastrointestinal distress, headaches, tachycardia or rapid heartbeat, restlessness, irritability, a tremor, elevated blood pressure, psychomotor agitation, left ventricular contractions, and caffeine can have a negative impact on sleep, which we must consider before we advise you to supplement. The impact of caffeine ingestion lasts a long time, several hours after you've actually used it. So after the game's over, you can't just turn it off. And we all know lack of sleep can hurt recovery and lead to negative impact on future performances. There are responders and non-responders to caffeine intake also. If you're a non-responder and you began supplementation, you might only see the negative impacts of caffeine consumption. Okay, let's take a look at the NCAA caffeine guidelines. Overconsumption is not tolerated. The NCAA allows 15 micrograms per milliliter of urine in the urine before any competition, and that's approximately 6 to 8 cups of coffee 2 to 3 hours prior to the competition. Always try new supplement strategies and training before applying it to competition, testing whether or not you may suffer negative side effects from that supplement. Always check with the coaching staff and the dietary staff before you try new supplementation, making sure it complies with NCAA rules and regs, and begin with the lowest recommended dose and increase dosing slowly to ensure there are no side effects with the higher doses. Try adding caffeine in the evening, sometime when you don't have a competition or anything big coming up, to give you an idea of whether or not there's any impact on sleep. So let's say games start at 6:30 normally. Take whatever you're going to take about 5:30 and see if it impacts your sleep. Use the form of supplementation that you're going to use, whether it's a pill or whatever it is. And remember, the more is better way of thinking does not apply or rarely implies with supplementation, and the lowest effective dose is far better way to go.